There's a special place in the hierarchy of education for HBCU institutions for educating its black students when at one time it was illegal to do so. If you've never been to or visited a black college, you've missed out. Nothing is the same on an HBCU campus, just like in black culture. And in the South, football is the king. The supporters, fans, alumni, family, and boosters come together in a special environment, oftentimes partying activities starting on Friday, and many times on Thursday nights, and sometimes even on Wednesday. Foods are being marinated, cooked, and prepared. Good morning, Dr. Thomas, Dr. Frederick. We appreciate you doing this and being so transparent. And my question is more along the lines of our student athletes, the students, coaches, fans, with what is going on with COVID-19 and what decisions or thought processes have we made in terms of with it spiking in different parts of the country. What happens if it gets to a point where one or two of the institutions end up having to make some decisions in terms of their student athletes and athletes at their institution or students at their institution and them being able to compete? As we went through the pandemic when it hit last year, when it was basketball tournament time, we had individual presidents that made decisions that took their teams out of participating. What happens with us in the MEAC in terms of that being a board of trustees, board of governors, president, conference? What decision, who makes that decision, and what have we thought about in terms of trying to make plans to the ripple effect it'll have throughout the conference?
Well, Mickey, I want Dr. Frederick to address that question, but I don't think many of you all know that Dr. Frederick is a physician and as president of Howard University. So Dr. Frederick has been really taking the lead on this across America. He's been on CNN, MSNBC, all the media platforms talking about your very question, Mickey, and we're very fortunate to have Dr. Frederick in our conference with this expertise to talk about this COVID-19 pandemic. Frederick.
Yeah, so Mr. Clayton, it's an excellent question. The first thing is I think we have to look at athletics again in the subset of what we're going to do at our universities. At Howard, I just released our reopening plan yesterday. And if you look at what we're doing there, I also, I'm a big proponent of having an HBCU approach to this because I think we have an unusual and sacred responsibility within the HBCU world. African Americans are disproportionately impacted. Our population is largely African American. And so when we think of bringing students back, faculty and staff, we actually have a different risk level that we have to be thoughtful about. And so with that in mind, next week, Tuesday at 5 p.m., we're putting on a webinar / video conference for all the HBCU presidents and chancellors, in which myself, the Dean and President of Morehouse School of Medicine, the President of Meharry, Hildred, and the President of Charles Drew Carlisle, we are going to lead a discussion around testing and contact solution for all the HBCU campuses. And we've been in some discussions with a couple of proprietors about testing, potentially getting free testing for all HBCUs, and also looking at a potential contact tracing solution that would help. If we're able to do that and coordinate it, that actually is going to help us significantly when it comes to contact tracing for athletics in particular, because we will have central databases whereby our athletes would be part of that. And as they travel from venue to venue and play, we would have the ability to very quickly isolate someone if they tested positive and also be able to contact all of the people that may have played against that particular athlete or use similar facilities, etc. So for us, I think it's a very important issue. So next week, we're going to start by having that conversation. And I think, as you know, we're the only HBCU that owns its own hospital, and I think that we have a responsibility to kind of take the lead, and that's why we're going to be out there doing that. And obviously, the goal is to help it impact athletics as well, more broadly, or I should say more specifically, so that we can employ some of those tools.
Okay, thank you for that answer. And if we reach a point where a decision has to be made about maintaining the status quo at our institutions, which will obviously have to have a serious effect on your athletic programs, where does that decision come from?
Yeah, so we'll do a little bit, I think something similar to what we did at the basketball tournament. We were actually meeting when a lot of the news was breaking about the fact that there were athletes that had tested positive, and NCAA was thinking of shutting down some of the conference tournaments. And as you mentioned, some schools made individual decisions. And I think the one good thing about the MEAC is that we all sat and made a collective decision, and I think that was helpful. It's not lost on me, though, that you've got some institutions that are part of state higher ed set up. So, a Morgan State, for example, is part of the Maryland state system. So while we could get together and have a conference, if the Maryland state system decides that they're going to do something that impacts UMES, Coppin State, and Morgan State, we've got to respect that, and we've got to, anticipate that that's going to happen. I hope that we're going to be able to convince the boards that, as a conference, from an athletic point of view, we are taking a holistic approach, and also really a collaborative approach where all of the institutions are weighing in. And you've got healthcare professionals throughout that leading these institutions. The head at Norfolk State has a public health background. UMES's chancellor has a public health background. So I think we are in good stead in terms of being able to make appropriate public decisions based on public health information. So right now, what we've done is set up an ad hoc committee. I've asked Dr. Wilson at Morgan State to chair that committee. He currently is chairing that and interacting with collegiate sports. Obviously, I'm staying involved and pretty active with that process. I met with a consultant again last week, and we intend to have a weekly check-in on what's going on. Because of the situation as well, we've been also meeting weekly with the chancellors and presidents and keeping them informed as well. So as much as we have a membership committee, ad hoc committee, we still are doing a lot actively with all of the presidents and chancellors to make sure that we are keeping everybody well informed of where things are and what the next steps are.
Just for your information, when we're just talking about this pandemic, we don't know what the fall will look like from an athletic standpoint.
Right.
And so we've had some games to be canceled already. And so don't be surprised that there will be other games around the country that are canceled. And we have a forecasting committee that's been working for over 2 months now that will make a report to the presidents and chancellors in terms of if we have to go to an adjusted schedule. And these are the options we should consider if the environment dictates that we cannot have a regular football season. And so the forecast committee of ABEs, SWAs, have been working on different game plan options for the fall semester and the spring semester as well.
And I will say, a couple of things though that are key. First of all, I think as a nation watching the next few weeks, one is communication. Is there going to be an improved communication and consistency of the communication? Right now, everything from face masks to gloves and to social distancing and gatherings are, kind of all over the place. And I think that's problematic for a country that's trying to open up the economy. And we have an economy that's dynamic, requires travel, and people moving around. So you can have that inconsistency from one jurisdiction to another. It impacts. You look at what's happening in New York and Florida now. Both have flipped. At one point, Florida's governor didn't want New Yorkers coming to his state. And now the New York governor doesn't want Florida residents coming to New York. And so we've got to be, I think, a little more consistent based on what's happening at that time. And right now, I think that lack of coordination is probably the biggest thing that concerns me. The second thing is you will have more positive tests as you have more testing. But what we must look at and what we must be, I think, diligent about is what is happening to medical resources. Are hospitalizations going up? And what kinds of hospitalizations? Are you using more ICU beds? So far, the spikes that we've seen outside of Texas and Arizona have not led to that. Florida does have a spike in cases, but their medical resources don't seem to be getting to the point of being overrun. I think we have to keep a close eye on Texas and Arizona. And then younger people are getting it more so, and we have to be clear as well. You don't get herd immunity in a society really until you're probably at a threshold, probably close to 60% infected. We're nowhere close to that, right? We're still down in the 2 to 5% range for the entire population being infected. So the only way to stop this right now is to practice social distancing, hygiene with hand washing, and face coverings at this point, and not having large gatherings where you have infections. And if you don't give the virus a host, it will eventually come to an end. So we've got to be really be thoughtful about that, and we've got to really make sure that we can shut that down.
Into a situation where multiple or enough schools decide to cancel their fall sports, is there an option where we could look at playing an amended schedule in the spring with those sports? Say maybe just a conference schedule or things of that nature as well.
Well, we've talked about that in terms of in our forecast committee meeting and nationally with the Commissioners Association and other ADs as well. I don't think that there is much support for moving spring football fall football to the spring. But I'm not going to say it will not happen simply because April 15th looks much different from May 15th. May 15th looks much different from June 15th. And July 15th is going to look different from, it's just, as Dr. Frederick was stating, it's a very fluid and precarious situation. And the dynamic of this pandemic is having a devastating impact on everyone, but to our profession for pro and intercollegiate athletics as well. So you've seen that teams that are reporting to summer school in reference to their workouts and being tested, they're testing positive, which was predicted by the epidemiologists and experts, and as Dr. Frederick indicated, that's going to happen. And they're going to have to be quarantined. And so you are probably going to see games canceled in August simply because of how this pandemic works out. And I think that everyone is hoping that we actually can have a normal football season, whether it be without fans in the stadium, or whether it be fans in the stadium that utilize social distancing, as Dr. Frederick indicated. So there have been some options that we have talked about nationally on the collegiate level. So, but I don't think any firm decisions are going to be made until August, to be very truthful about it. And that's a personal opinion. And so unfortunately, I don't see moving the fall schedule to the spring. That's another dynamic that's just problematic. You have winter sports, you have spring sports, and then you're gonna push a particular football into that, and then don't forget about the NFL, and so it's just so much that's going on right now, and I think one of the factors for intercollegiate athletics has to do with the cost of testing, the cost of PPEs, the cost of quarantine. All those are financial factors that's going to play upon what an institution can or can't do, and they have to make decisions regarding that.
Stay up to date with the latest from INSiiGHTS. Visit our website at INSiiGHTS.com. 2 I's in the middle, INSiiGHTS.
INSiiGHTS is a copyright of MAC4 Enterprises, a Florida corporation. This broadcast is produced under the exclusive ownership of MAC4 Enterprises and is the intellectual property and trademark of MAC4 Enterprises. Comments of the host and other individual speakers on INSiiGHTS represent the independent thoughts and representation.